This is one of more than 200 hospitals across New York State where all staff, from doctors to custodians to nurses' aides, are required to be vaccinated. But not everyone is pleased with the state's requirement.
Why do I have to get it for? For what reason? It's not doing anything. You still can get sick.
But a doctor specializing in respiratory diseases, including COVID, points out,
in order to even work at a hospital, you need to show proof that you've had all your vaccinations and they're still working. This isn't anything new, and it's unfortunate that it's so controversial because it really shouldn't be.
Anyone not in compliance is no longer employed, as the director of the emergency department here at Maimonides Medical Center pointed out.
Of the thousands of employees we have here, we only had 40 people we had to let go for that job, which is about half of 1% of the whole hospital staff.
Similar results at some of the largest healthcare systems in our region and the state. New York Presbyterian said it imposed its own vaccine mandate last week. It's not reporting significant staff shortages. Neither are the 11 hospitals that the city operates, so vaccination rates are high in the hospitals. And the person in charge of emergency medicine at one of them says that this situation, put in place by Governor Kathy Hochul's order, could be a prototype for other workplaces.
This model of mandating vaccines, getting people to have a conversation about the vaccines with the people that they trust, and then ultimately getting people vaccinated, I think it's a great model, and I hope it's applied in lots of different areas.
So it could become a prototype for other workplaces. And speaking of other workplaces, one of them that does require all workers to be vaccinated as of today are nursing homes. And you mentioned 92% of them have been vaccinated at nursing homes, according to the governor. Her order also allows her to bring in medically trained National Guard troops, retired workers, and workers from out of state to fill that 8% gap. Will it be necessary? At this point, it's not clear that it will. And certainly at hospitals that we've visited today, not really a need so far. We'll keep on this one, of course. Right now, reporting live from Borough Park, Brooklyn, I'm James Ford, Pix 11 News.